Well, good morning, everyone. I hope you're doing great this Wednesday morning. My name is Abena Asante, and I'm a senior program officer with St. David's Foundation. And so excited to welcome you to join the Libraries for Health RFP information session. The Libraries for Health initiative has been informed by interviews with Central Texas libraries representing most of you on the call this morning. And if you recall, mental well-being was identified as an area of need when Kit did the interviews a couple of months back. Again, excited that you could join us. So from the St. Davis Foundation team, I have Angela Hadi, who provided us the background jazz music, and she'll be operating the Zoom slides this morning. Also from the foundation team, we have Emily Burgers, who will be monitoring the chat, and Christina Thompson and Holly, also with communications, representing St. David's Foundation. I'm also happy to introduce you to two of our advisors that we've been working with in shaping and crafting the Libraries for Health initiative. Dr. Kit Matthew, formerly with the Institute of Museum and Library Service, and Dr. Lindsay Iyer, who is a social behavioral scientist with RAND, and both Lindsay and Kit are part of the foundation's subject matter expert group that has been providing guidance to us as we develop and co-design the Libraries for Health initiative with your input. Today's session will be recorded, and the recording and slides will be accessible to you and your colleagues who are unable to join us today. So please look out for the slides in about 2 weeks, which will be on our website. We do love to hear your questions, your comments, and I invite you to hold the questions towards the end, and we'll invite you to either chat your questions or Emily can monitor the chat and share the questions that you have. Again, welcome, and I'm happy to walk you through the St. David's Foundation's Libraries for Health information session with my co-presenters, Dr. Kit Matthew and Dr. Lindsay Iyer. Okay. So you all know that public libraries are central to a community. You all are anchor institutions. You bring people from diverse backgrounds together. You are gathering spaces, you connect, you educate, you provide internet access, and with COVID and also with the winter storm that we experienced, I'm sure the role you played in the community just became bigger. So St. David's Foundation is a foundation here in Central Texas, one of the largest health foundations in the nation. We were established in 1996 through a unique partnership with St. David's Healthcare. Through this partnership with St. David's Healthcare, we are able to reinvest proceeds from the health system back into a 5-county area where your libraries are anchored. Annually, we invest about $80 million in the community through a variety of programs, grants, and other philanthropic activities. We haven't made a whole lot of investments in libraries. We have a few library grantees, which has been recent. We'll love to partner with libraries as we strive to improve communities' health and well-being. Also at St. David's Foundation, in addition to the grant making that we do, we also have a scholarship program where we support high school students with scholarship support for 4 years of college or community college education. We also have a loan repayment program. So in case anyone should approach you at the library and ask for scholarship information or loan repayment, St. David's Foundation has resources, and we have that on our website. We also partner with a lot of funders, Texas rural funders, including Tucker Foundation, that you are aware of, Episcopal Health Foundation, and Methodist Health Ministries. On our next slide, which talks about our footprint, it shows the 5 counties that the foundation invests in. Bastrop, Caldwell, Hayes, Travis, and Williamson counties. And you see that Bastrop and Caldwell counties have a blue shade, and the rankings that you see under the counties' names represent the Robert Wood Johnson Foundation's County Health Rankings and Roadmaps that ranks counties within each state relating to health outcomes or how healthy a county is. We know that when you look at health and well-being, there are many factors that impact a community's health and its well-being. So you hear me use the term rural loosely, but rural means communities that are truly rural or formerly rural developing into suburban or urban with isolated neighborhoods. What we plan to do is, in the interest of time, we can send you a link for more information on the county health rankings and roadmap. But the key takeaway from this slide is that we know that there are opportunities for other counties to be healthier, and it's important for the foundation and other sectors to think about ways in which we can engage differently and build on existing community assets, such as schools, such as libraries, such as nonprofits, to effect positive community change. So I represent the rural area, being the Thriving Rural Communities Program Officer. So very early in my work there, I quickly realized that there were fewer nonprofits in rural communities, and it was important to identify trusted, non-traditional partners whom to work with, hence looking at ways to engage with libraries, schools, and other sectors. Angela, next slide, please. Okay, so I want to talk a little bit about health equity since it's the foundation's North Star. Through the 5 goal areas named below on the slide on the right-hand side, we strive to provide a fair and just opportunity for all Central Texans to be healthy. So in defining health equity, we believe that all Central Texans should have the opportunity to achieve optimal health, and that there are no avoidable, unnecessary, unfair, or systematically caused differences in health status due to age, race, geography, ethnicity, or the lack of something within their community. Health equity has a lot of connection to the social determinants of health. The social determinants of health are those influences that impact a community or an individual's health or well-being. So it's more around access to good schools, access to parks, access to good libraries, access to healthy food, having playscapes, play areas, having good jobs, having affordable houses. All these little things impact how healthy a community or an individual is. It's not just about going to the doctor's office. In fact, 80% of all health happens outside of the doctor's office. So what can we do? One thing we can do is to partner with existing anchor institutions, such as schools, libraries, universities, faith communities, and others, because you provide the neutral gathering spaces that can be built on to work on health and well-being issues. The next slide also is about social determinants of health, and I'm not going to go deeply into it, but basically health happens where you live, where you learn, where you work, where you play, and where you pray. So health is all around us, and the foundation defines health broadly. And so in this Libraries for Health initiative, we are looking at how we can partner with libraries for them to build on their skills to gain additional skills in considering mental wellness programs that are part of your customer or your patron's journey to better quality of life. We are also looking at this partnership with libraries where we can form purposeful partnerships with community-based organizations that can embrace and wrap services around patrons so that they can help them walk through the mental wellness or the wellness journey. Through this initiative also, we are interested in strengthening your programs and services so that the whole patron, the whole patient, the whole customer needs can be addressed. Libraries are already playing the active role within the social determinants of health. Earlier on, I'd mentioned some of what you did. And library patrons experience many of the same barriers to fully benefiting from assets. And we believe that this partnership with libraries and other community-based organizations can help eliminate some of those barriers and fill some of those gaps that can provide the pathway for healthier individuals and healthier communities. And with that, I'm going to pass it on to Kit and Lindsay.
Great. Well, nice to see everyone. Good morning, wherever you are. And let's go to the next slide, which basically touches on some of the same topics that Abena just mentioned. But on the next slide, the state of mental health, I wanted to just highlight how we are at a pivotal point where we have a lot of systemic issues and barriers relating to mental wellness. So, for example, education, loss of income, lack of health insurance, and a shortage of mental health counselors and psychiatrists that is projected by 2030. So those are all what I would call a sort of systemic embedded problems. And on top of those stressors, we also have COVID, which has in a survey that was done, a study that was done in October of 2020 from Episcopal Health, some of those statistics on the left are pretty striking, that in Central Texas, we had 23% of the population as a whole reporting a major negative impact in terms of anxiety or stress. And 45% of those with less than a college degree had lost income, and those under 65 without health insurance experienced household income loss. So we have a lot of amplifying factors on top of those systemic issues already. And it was very striking to us when we looked at the projections of available mental health resources in our communities, it's not a good picture across the country, let alone in Texas. So we wanted to just paint that picture, because what's really interesting is a lot of the barriers that you as a group talked about, people unable to access your services and your programs and your resources like transportation or digital literacy or mobility or other health conditions. They're working 3 jobs, so they can't get to the library. All of those are also barriers to healthcare, and in particular, mental health care. And we'll talk a little bit more about that. But as many of you said, there is a stigma and a shame for admitting that you might need help, let alone being seen walking in the door of a provider. So let's go on to the next slide. And Lindsay and I are going to sort of tag team on these next couple of slides. But I wanted to talk a little bit about what are the goals of the RFP. And the first thing is, as a grant maker, it's you want to have the long view, and relationships are part of that long view between both all of you who end up participating in Libraries for Health, but ultimately with your partners and your community members. So in this first 2 years, when we say a learning collaborative, that means together we will build upon proven resources such as mental health first aid. We'll talk about the patron mental health journey. We'll talk about evaluation and other topics as a group, and really work with you to contextualize that into each of your libraries. Because the goal here is to really bring all that knowledge and expertise that each of you have into this 2-year opportunity. We also, one of the foundation's goals is to improve existing mental health competencies within libraries, and we want to see that within library programming and initiatives. And what that means is it's that seamless patron experience from the first point of contact. Staff are empathetic and understand the person's barriers. They can point them to options for programming or mental health resources in the community, but also the lay mental health worker that we'll talk about that. And when we say set the stage for future partnerships, this is really being able to not only have a list of resources in the community, but being able to ensure that the patron who needs official, formal counseling or medical advice or access to insurance information isn't just getting a piece of paper in their hand. They actually have support in taking that next step. So it's really focusing outward on the community and the patron. And when we talk about unmet mental health needs, many of you expressed what you believe those are. People need treatment, or they're not getting access to any type of mental health provider. Some of you talked about the long distances. Some of your community members had to travel, or there's just not good insurance coverage, or it's private pay. And then the final piece that I want to talk about as a goal is the evaluation, which is really, when I say lessons learned, it's not only how well do these proven practices in community mental health, work in the library setting, but hearing from all of you as we think about your colleagues, as well as carrying this work forward, what else do you need? And what tools and supports would make this stick and be even more effective for your patrons in your library? So I'm going to hand it over to Lindsay, Dr. Lindsay Eyre, who's going to talk about the second slide of goals.
Great, thanks, Kit. So following from what Kit said, we want this to be an opportunity to start a program like this, but hopefully, again, taking the long view, this would be something that could be sustainable and scaled up beyond this initial 2-year period. So we are hoping that by infusing these mental health supports into libraries, that this will sort of set the stage. This will be a first step towards modeling how this could be done at a greater scale within each of your libraries, but also within other libraries. And so we want to build upon, again, those demonstrated successes from other locations where similar models have been tested in other organizations, but not yet in libraries. So the whole Libraries for Health model that we're seeking to implement here is based on a concept called task sharing or task shifting, where mental health tasks that can be done by non-mental health professionals are infused into community-based organizations such as libraries. And what this does is this addresses many of the barriers that you all have identified already. It brings evidence-based, proven mental health strategies to the community, so they don't need to take those extra steps of identifying a mental health provider, paying, the costs associated with that, when we know that there is just such a strain on our formal mental health system. So we're bringing mental health supports to community members where they already are. And you all, as parts of the community already, are trusted and familiar places and people. And so that also helps folks feel more comfortable getting those mental health supports. So that's the model that we're hoping to build here. And we want to make this so that it's again a collaborative effort. So we'll be co-designing the program together. There's not a one-size-fits-all. Some of the libraries represented here may already have some social workers or other sorts of mental health supports built in, and that's fine. It's also fine if you do not have those existing supports. So the idea is to design this program so that it fits each library's needs. And then we also want to, again, as Kit said, make this as a collaborative effort at every level. So these sorts of warm handoffs that she referred to, where instead of just saying, it seems like you could really use some mental health care, call the county mental health department at this number. Instead, we'll be building in some relationships to make those referrals or warm handoffs work better. So we're really infusing behavioral health care into the library setting. So if we go to the next slide, we'll talk a little bit more about what the evaluation of this model might look like. And here again, collaborative is the name of the game. So we're thinking of the evaluation as a way to document and understand how this model can best be implemented in libraries. So that means documenting and evaluating what works well as what doesn't work well. And when challenges are confronted, how they're overcome, what different strategies are tried to address barriers that arise throughout the implementation process, so that we can learn for the future. And we are thinking that this will work best if we're designing the evaluation and the key questions and priorities so that they're answering your questions, the things that you feel like you want to know in order to sustain this program or expand it in the future. So I'll turn it back to Abena now for the next portion.
Thank you, Lindsay. Great. So when we had the feedback session in March and April, you made it loud and clear that you had a lot of work that you were doing and that you may not have the capacity for a new program. And so with the Libraries for Health initiative, we heard that. So we are not requiring any project proposal. This initiative is focused on your library and your community. So when you get a chance to look at the questions, we have multiple choice questions and short narrative questions. We don't expect it's going to take a long time for you to complete those questions. What we are interested in seeing is in your responses, we would like to see express the organization's interest, your capacity, and your readiness to undertake this work. So we're not looking at any competitive proposals. So what we are interested in assessing through the rubric, it's your library's organizational interest, your capacity, and your readiness to embark on this learning collaborative on mental wellness. When you read the RFP and as you respond, start gathering the required documents that you would need to submit. If you are not sure of anything, please reach out to us and we can provide additional details. Sorry about the noise. While the awards are unrestricted, the expectation is that the funds that you receive would be used to ensure your library's full participation in the cohort. We plan to offer office hours to allow you to ask questions and also provide any comments and other thoughts relating to the initiative. We also are going to provide an initiative consultant that is going to help guide you through understanding the initiative and any other questions that you may have. Angela, on the next slide is the financial due diligence. We know that there are some libraries that are nonprofits and some libraries that are governmental entities or municipalities. The foundation entertains proposals from nonprofits and governmental entities, so that is not a problem. In looking at what to attach, we request that you include your organization-wide budget. And so if it's a district, it's important for you to include the district's budget. Also around documentation and attachments, we request that you include your current financials. If you have audited financials, great, please include it. And if you have Form 990, also include it. Again, I want to mention that if you're in doubt or if you have any clarifying questions, please shoot us an email or reach out to us. We are a responsive grant maker, and we are looking at ways in which we can help, remove some of those barriers that may impede your library's ability to apply. We have a compliance officer in our finance department, and she, will review it. And if she has any follow-up questions, Jocelyn Wilbel, she would also follow up with you. So Jocelyn, do you have anything to add to this?
1 second. Can you hear me?
Yes, we can hear you.
Okay. Yeah. I just want to add one thing. So basically, in order for us to identify your status, we usually require like a determination letter, which will basically state that you're a 501c3 or governmental entity. But I would also want to add that the documentation for current financials, audited financials in the Form 990s are only for 501c3s. So if you're a governmental entity, you do not need to provide those. That was it. Thank you.
Thank you, Jocelyn. On the next slide, it's a description of the initiative, the budget, and the timeline. So this Libraries for Health initiative, it's a 2-year initiative currently, with the possibility of it being expanded additional years based on how the cohort and the learning collaborative evolves. And so we have $1.5 million allocated for this initiative, $1 million for 2 years for the libraries. And it's our goal to get an intermediary, a technical assistance provider, someone who can support the learning collaborative around capacity building, learnings, and other activities to enhance the Libraries for Health initiative. So we released the initiative. We launched on August the 2nd. The information session is today. And as a reminder, it's being recorded. And so if you would like to listen to it again or to share it with a colleague, the recording will be made available within the next week or two. The deadline to receive your responses is September the 7th. And October 25th is when the Foundation's board makes the decision relating to which libraries are going to be funded and which ones are not. So October 25th is when you hear back from us towards the end of that week. I will encourage you to start your application early on, just in case questions come up. And please make an effort to complete those attachments and all those supporting documents. As I mentioned, we do have office hours, and feel free to email Angela and set up a time for any of these times listed here. In the event that these times do not work out for you, we will look at ways in which we can accommodate you. In my earlier slide, I mentioned that we will provide an initiative consultant that can help with providing assistance with the application development and any stakeholder outreach. So Kate's email address is here. Most of you have Kate's email address as well. So please reach out to her with any questions or any request for support. Please don't wait till September 6th and start reaching out to her. We also are putting together an FAQ, which we will update regularly, frequently asked questions. And so those also will be available on the Foundation's website. And with that, Kit?
You covered everything. And again, I hope there's a sigh of relief that we're not asking you to come up with a new project. So I'm happy to help you if you want to be a sounding board. And I know Abena and Jocelyn and others, will have a quick turnaround on questions. So again, this is very exciting, and it's really an opportunity for you and the Central Texas area libraries to really shine. So I'm excited.
Thank you, Kit. And so we are open for questions. There is no silly question. Ask us any questions or provide any comments.
And if you need to think, please come to office hours. If you need to ruminate, because I'm a ruminator, that's what the office hours are for.
There, I asked in the chat, I'm hoping to hear some concrete examples of projects that might be funded. Can you give any examples?
No, you're not submitting a project. You are describing, have you looked at the RFP yet?
Yeah, right here.
Yeah, so you are describing your community. What are the general health and mental health? What's the situation in your community? What have you done before as a library? What do you think would be the hurdles and assets that you can bring to this project? So you're not proposing any program or project. You're describing your institution and describing what you know about the community, and that's going to help us get this going as well.
So Morgan, to add to that, so the funding that the libraries receive, can be used for resources to support mental wellness, or it could be used for something within the library around mental well-being. It's not restricted.
Right. And if you need to backfill to attend these cohort sessions, or, if you find that something you end up trying as part of Libraries for Health really takes off, and you need to hire temporary staff, you want to try that? Great.
Mm-hmm.
This is Annie from Austin Public Library.
Hi.
And my question is, I read in the RFP that if we were not quite ready, that there were opportunities to participate in professional development and some learning opportunities for our library workers. How might that work? Do we need to complete anything for that or express that particular interest?
I think it would be really helpful, even if you don't feel ready to fully participate, if you could fill out the application, because that all this information is not just used for award decisions, but designing the cohort, like who needs to be who needs what in the cohort learning. So it would be really helpful if you could do that, if it's not too much work, because I think, again, waiting to see how you describe your community beyond the data that we can all see, but what are you seeing? What are the opportunities and barriers? Our vision is to have some of the learning opportunities for the cohort also be available for people such as your team.
Thank
And
you.
I'd like to respond to Sally's comments relating to the lay mental health worker. And so with this initiative, we are looking at a lay mental health worker being available at the libraries. Also, with this initiative, there would also be a mental health provider that the lay mental health worker or peer support specialist or community health worker could refer patrons that needed additional services to. And so the question has to be, do they need an office with walls, or is it sufficient for that person being the peer support specialist, lay mental health worker, to have access to a walled conference room as needed? And I would say walled conference room or some private space as needed.
And then there was a question about the size of the grants. So the size of the grants is going to be based on the size of your library, among other factors, but that's the primary one. And the mental health worker's salary is not part of your award. So that whole relationship and payment and oversight will be by this expert provider that Abena referenced earlier.
And Karen has a great question. She's asking if there would be a listserv so that ideas could be shared and questions shared via email. So we have the FAQs, the frequently asked questions, which would be updated frequently or often. So I'm throwing this question back to my co-presenters and my comms team, whether the listserv and the FAQs will serve the same purpose or whether we have to look at it differently.
Well, I think the way I understood the question was we have the FAQs for the RFP, but then maybe I misunderstood the question in the chat. Was that a desire to have, once the program launches, to actually be able to share ideas among the group? That was the way I took it, but maybe I misunderstood.
Karen, could you clarify, please? Karen Ellis, maybe there are more than one Karen.
Maybe it's on mute.
Because it's my understanding that with a learning collaborative, yes, there would be an opportunity for the libraries, part of the learning collaborative, to engage, exchange information. So I don't know whether that is the same thing as the listserv.
So for the listserv, I know a lot of us are on the CTLS listserv, so that might be kind of what Karen's thinking about. Just we can pop on there anytime with a question or a suggestion, and it just goes straight in everybody's email box.
So we'll think about the best way to do this, because we will have two years or more together. So this is sort of a technology question for the foundation. So noted, great idea, and we'll figure it out.
So thank you so much for that question. And this is being co-designed, so I invite you to ask questions or provide any comments that come up. And so there's another question here, whether is accreditation required? It wasn't listed in the eligibility criteria. So I'm going to throw it at Kit. I know we worked very closely with TESLAC through the development of this initiative.
Yes, so there is a note in the RFP that's asks if you're accredited. I think it's towards the end, and if you have lapsed recently, please to explain that. So we welcome, even if you're not accredited but aspire to be accredited, or if for some reason you have lapsed. I know local funding these days is pretty dynamic. So please do apply, but there is a question, I forget the number, that asks about that.
Thank you, Kit.
This is Emmy. So I have a question regarding existing partnerships that we have through written agreements with mental health providers, community-based organizations already that serve in this role and capacity in a collaborative way with us in the city. So does that factor into this, how we respond, or?
Yes, so you should
that's one of our service models. Yeah.
Yeah, so you should describe that. I think there is a question about other programs you already have or services and partners. So do describe that, and you know, we want to fully understand each applicant, and we'll work with you to leverage what you're already doing. So we're not trying to replace or stop or anything like that.
It's like, how can we build on your existing strengths, your existing assets, your existing capacities? So I know some of the libraries represented here have had social workers embedded within their libraries. And I was reading something recently that Kit shared from Oak Park Library out in Illinois, where they have social workers embedded and they use a trauma-informed approach in working with patrons and community members. And listening to that was really inspiring, relating to their reach and what they've been able to do in the community. So this is the beginning of this initiative. And so I'm looking forward to what you do, the learnings, and how this could be advanced so that community well-being is enhanced. Any comments from the group? Is there something that you expected to see that wasn't mentioned? Is there something you've heard elsewhere that excites you?
This is Sally Mitchell from Georgetown. I'm interested in this grant and it seems like it has a whole lot of potential, but the thing that I'm struggling with is that it's not very concrete. And so it's not a situation where I am developing a project proposal that I would then submit a grant for. And because it's a less concrete project coming to me, I don't have anything that like I have to get my library board approval, and then I additionally have to get my city council's approval. And I do not, at this point, with the information that I have anything to take to them. And I have to, like, I'm seeking my library board's approval tonight, and in order to get on the council agenda for the August 24th council meeting. And that's the trouble, is right now with the information that I have, I don't know if I can responsibly seek approval for this grant because I still don't know what I'm asking for.
Well, this is what I would call a developmental program. So it's not coming in with, we want you to do this type of work with this type of population and submit a proposal. So this is a way that the foundation wants to partner within the context of your community. And you all know your community better than anyone else, and use a proven community-based mental health model to support your patrons. So if by chance you feel that your patrons don't have any mental health and wellness needs, then maybe this might not be for you. But I think many communities are experiencing higher levels of stress and anxiety right now. And as a great community asset, I would hope your board and city council would be excited to investigate how to use you as an asset.
I think they will be interested in this. There are questions like, like logistical questions, like finding a desk, but there's going to be questions about, is this person going to need access to my patron database? Are they going to need a city email address? Are they going to need access to, things like that are security issues that I have to work with other departments?
So they're not going to be a city employee. Right. So there were a couple of questions about that. They are going to be reporting to the expert mental health provider and our expert designer of this program. And yes. So I think it's really, would they support you in participating in a capacity building and sector building opportunity?
Okay. I guess the idea is we're essentially going to be sharing our space with this program. And there are
Well-
benefits that will come to us from having this program in our space.
Yes, for your patrons. And also there is an opportunity, if you feel appropriate, to actually take some of the mental health supports and techniques, and perhaps maybe there's a program that you feel already, is appealing to people who are stressed or feeling anxious. And you say, maybe I could strengthen this a little bit, so that the person has this opportunity before they seek counseling.
Yeah. And I guess then the next question is going to be like the questions that I'm going to need to be able to answer are what's the long-term plan here?
Well, again, that's the
This is my-
challenge. Yeah, that's the challenge and the beauty of creating something new within the library context. So this has been done in communities with other community-based organizations, but it hasn't been done in a integrated way in libraries. So as Lindsay used the word infuse, and the idea is to infuse this patron mental health mindset and techniques throughout the library in the best case. And everybody's going to be busy, we know that, and has, trade-offs that will have to be made.
Yeah, I guess the question is, at the end of the grant term, is there going to be some loss of service that my city needs to be prepared to fill a gap? Is there going to be, is the idea that, ultimately, this is a 2-year training program that results in a library staff that is able to, use trauma-informed principles for all of our public service, or like that? Those are the questions that I'm gonna be receiving that I need to have answers to.
Well, I would turn it to you and say, what would you aspire for your library? Because your patrons. What right now, based on what you know about your community, what would you hope to see? I'm happy to talk to you and after this to help you prepare, if that's helpful.
Okay. All right. Yeah.
Happy
I'll keep working through some of my questions.
Yeah. Happy to help however I can.
I have a question regarding the mental health provider. So we library would not be able to vet or select or hire or have any influence on the individual. I'm a mental health provider myself, so I'm licensed, and so there's a lot of mental health ethics, and I'm monitored by the board, so
yeah.
I'm very concerned that what is our role in this? And so because you're impacting individuals' personal mental health, so we have local providers, they're experts in the field. I can do this, but that's not my role here at the library. So because I'm not practicing. I could practice, I don't know, but I'm not practicing. And I haven't told my board I'm practicing in the library. I contract out, or we collaborate, and we have multiple partnerships where individuals credentialed, vetted, and trusted by the community in our little community here, and that know the ecosystem of social services here locally. That's so important, right? Are connecting and linking. So I'm just concerned about this. It's kind of disassociated somewhat, or it feels like it's disassociated from library.
Yeah, you will be involved. I mean, it's more that oversight, and for a lot of people having to hire and recruit, so for consistency in training and so forth, we wanted to have sort of a baseline. But absolutely, in your case, I mean, you're sort of an a good exception in that you have that expertise already. And I think that would be so helpful, actually, as we think through this of onboarding and training and figuring out. I mean, the beauty of this is we have this whole range of libraries. We have people who already have deep connections in the mental health community, like yourself. And then we have some other folks who maybe haven't, put their toes in the water at all. So no, you're not just going to be told, here they are.
So I want to do an interpretation check, if you don't mind, to make sure I'm kind of thinking about this the right way. It kind of, reading through the information, it kind of feels like this program is kind of like the Family Place Libraries model, where staff gets a lot of training, not to be the professional, but to identify when a professional is needed and who that might be sent to. Is that more kind of the model?
Yeah.
Like we're not having a professional in the library, we're knowing when to refer to them?
Well, yes, you will have a trained, lay provider. So you will have that resource at a more staff level, in a sense, because you all will be trained as well as the lay provider. But yes, you will then have a clinical or professional provider that you could refer someone to. So, Lindsay, do you have any thoughts?
Yeah.
I've been talking over you, I'm sorry.
No, that's okay. I was just going to clarify that, the core model is based around the idea that there will be a lay mental health worker who is trained and supervised by a licensed mental health provider. So just relating to the some of the concerns that I heard Emmy, I think, bringing up. But then also your staff at your library will also have opportunities to receive training and be involved in potentially also doing some of the delivery of these strategies. But I also want to clarify that what's done by the library staff and the lay mental health worker is not going to be like formal mental health treatment. We're talking about things like psychoeducation, mental health first aid, potentially some screening, like depression screening, things that have been proven to be effective when done by folks outside of the traditional, licensed mental health professional community, and that also are, within the ethical and legal bounds of what's allowed to be done by those folks.
Can you define for me in this specific term what you mean by a layperson? Because I think there are several different ways to interpret that. What is y'all's interpretation?
So, okay, I'll start and Lindsay will add to it. So layperson could be a peer support specialist. It could be a community health worker, not necessarily somebody who's a licensed clinician. Lindsay?
It's just a broad term to define people who are not licensed mental health professionals in this case.
I think the key, though, is that they are willing and have the capacity to establish trusting and empathetic relationships with people of various backgrounds. So that's, I won't be doing the hiring, but, I know from other people who have, that is, and I've talked to in other libraries, they say the person doesn't need to have any background. It's nice if they do, but it's more their personality and mindset and how they treat other people.
And also we've found that it works best when that person is also from the same community as the folks that they're hoping to help. So they're, they speak the language and, literally, but also, culturally, so they understand the community that they're working within, and that helps to make them more approachable and more effective. Does that help? to answer your question.
Okay. So I'm happy to say that we do have those office hours available. And please reach out to Angela, email Angela requesting a time slot so that we can answer your questions. I love questions because questions are thought-provoking and it may help us think through on something that we may not have thought of or provide additional context to help with understanding. It's 11, yeah.
Oh, Abena, it's Emily. I just wanted to flag if folks need to run, really respectful of time, but one other question we had was, is this program targeted towards adults only?
Yes.
Yes, right now, yes.
Okay.
I mean, I hope maybe in the future, and I'm not committing the foundation, but in 5 years, 4 years, who knows?
Who knows?
It might expand.
Perfect. And then one other question is from Carol. This is for Kit, and I think just repeating what you already said, would you please go over how much funding will be determined? Is it based on size of the library? And I believe you said that.
It's based on your service area primarily.
Carol, is that helpful?
She says yes.
Great. She said yes. Great. Okay. So being respectful of time, and I really do want to continue the dialogue if you have any questions. So please take advantage of the office hours that we have available. And if you can't make any of those times, we'll look for other ways in which we can have a conversation. Kit is also available to help you provide any assistance with the application review. And so one thing that I leave you with is that the foundation is interested in building the capacity of libraries, anchor institutions around mental wellness and bringing other non-traditional partners, leveraging and building on those assets and those relationships that libraries and other entities have to promote community health and well-being. So how can we support you librarians or library staff doing this work around health and well-being in a way that has good data evaluation, its effectiveness built in around it? Okay. So please reach out if you have any questions. There's a link below here for general questions, RFP at stdavidsfoundation.org. And we will add the questions that we receive to the FAQs if appropriate. And with that,
Abena, do you want to reiterate where the FAQs are going to live?
yes. So the FAQs will be on the foundation site, and when we do, when it goes live, we will share a link with all of you so that you have access to that.
Thank you.
Thank you. All righty. Thank you for your